Welcome back, everyone, to CGM Sweet Talk with the Sugar Queens. This is Season 2, Episode 4. I'm Dr. Eden Miller, an osteopathic board-certified family practitioner, a diabetologist, and obesity medicine specialist from Bend, Oregon. Jen.
Hi, I'm Jennifer Goldman. I am a pharmacist, clinical pharmacist at Well Life Medical in Peabody, Massachusetts, and a professor of pharmacy practice at Massachusetts College of Pharmacy in Boston.
Davida.
And I'm Davida Kruger. I'm a certified nurse practitioner. I'm at Henry Ford Health in Detroit, Michigan, in the Division of Endocrinology, and thrilled to be here.
Oh, ladies, we've got a great episode today. It is titled CGM Wisdom That Reigns Supreme. So now's your chance to hear some of the pearls of wisdom from the Sugar Queens. For the next 25 minutes, we're going to discuss a variety of FAQs related to CGM setup, the use, CGM in patients with diabetes, patients that are looking for improving their overall health. So please drop your questions. We love it when you engage with us. We want to make this real. Okay. So let's get started with a very straightforward question for our CGM newbies, okay? Davida, so what if a clinician is unsure about CGM and is afraid, oh my gosh, it's gonna slow down my workflow? What are you gonna tell them?
I'm actually going to tell them it's quite the opposite. When you think about trying to access data, if someone does finger sticks, how do you access that? If all you have is an A1C, how do you make a decision? CGM, and we've talked about how to interpret this in other places, and we will again in the future. But if you think about how it works, it actually enhances the way you practice. It does not slow you down. And it does reduce the burden, we know, for the patient. They can bring you clean data. They learn from it. And the other thing that improves your practice is that the patient tends to be able to follow the plan of action that you've set up for them and make behavioral changes. So I think overall, the clinical burden is actually reduced. Now, I hear all the time that, you can only get it for patients that are on insulin, and you can only get it from these insurance and that insurances. I think that's a really old way of thinking about CGM. Almost every insurance will cover it if patients are on at least one injection. Certainly Medicare will, but more and more patients are, insurances are covering it for people that are on other therapies. And then don't discount that the patient may in fact want to pay cash for the opportunity to wear CGM. So I think it actually speeds up what we do. It doesn't slow it down. You have to come up with a plan of action for your clinic, but it shouldn't slow you down.
Jen, give us your queenly wisdom in your setting.
Everything Queen Davida just said, but I do reassure people that once you just create a simple routine, like you review the CGM downloads during vitals or MedRec, and it actually saves time. It makes things quicker and easier, for sure.
Yeah. What I always say to new clinicians is a job be done is half done. That means that if you decide to do CGM, you just create your workflow. That's going to really help you get a long way. Okay, so we just want a little bit of a disclaimer because we're going to give you our queenly thoughts and expert opinions. But remember, we still want you to check the manufacturer's and user manual so that you stay with that for your patient. You can get the most accurate information. But I'm going to start a little bit about talking where we can put sensors and why, right? Because we know that the sensors have a very specific location. That's where they were studied. But some of our listeners out there don't understand that. Honestly, when sensors go on the back of the arm, it's not just because they're there or they were studied, it's because they heal slower on the back of the arm. I often say a sensor doesn't necessarily fail, even though they can, it's that our skin fails. And so you can see here that we have different locations where they're indicated, different things of where we place them depending on it. But I want to talk a little bit about the alternative sites, but they can vary with accuracy. But I have some people put it on the upper outer hip, which is really similar to the skin on the back of the arm. I had a lady who refused to wear a CGM because she didn't want anybody to see it at all. And she put it up in just above her breast area. Now, this is something that you're going to have to do as clinicians and determine that. Do you have any other alternative sites that you have given people?
You know, I think it's important to go with the flow on the patient. I agree with everything you just presented, and these are the reasons. But I have people who are already wearing a pump on their abdomen and they don't want to use an arm. They want it in the same spot. So sure, go there. I've had people who prefer it on their lower back, upper buttocks, which we tend to do with children, but I also have adults that do that. So I typically start with what the manufacturer says, and then I go from there.
Great.
When
I love it.
When they ask me, I say, when they say, can I wear it somewhere else? The answer is sort of maybe. So
Yeah.
This is how it's recommended. Maybe. And if something seems off, it doesn't seem right, that's when you would confirm with a finger stick.
Oh, I love it. Okay, now let's transition to an area that I actually love a lot, and that's when and where to remove the sensor. So Davida, walk us through that, because you know what? I still see that. I had a patient the other day who was wearing a sensor, and they were like, I'm having a study done, and I have to take it off. And I was like, no, you don't. So walk us through this.
It's really funny because I get the patient all ready for the scan or whatever it is, and then I give them my cell phone number, and I say, if the technician has a hard time with you or gives you a hard time, have them call me. And I just had a patient who had an MRI at 3 a.m. and I was ready for it. And the technician will leave the patient. But this is also one of those moving targets. And the more we know, and the easier it is for the patient. But for the Dexcom G6, remove for the MRI, a CT scan, or high frequency electronical heat treatment. For the G7, also the MRI or high frequency electrical heat treatment. You can keep it on for the CT scan. If you keep the sensor out of the scanned area and cover the sensor with a lead apron during the CT scan. For the Libre 3 and 3 Plus, again, you want to remove it for the high frequency electrical heat treatment, but you can keep it for the CT scan, and it's okay to keep it on for a 1.5 or 3T MRI under certain conditions, and that is the condition. The big condition is for 1 hour following the MRI, do not use the data for correcting or anything. So this was the one that I just had was a pump patient of mine who was on a 3 Plus, was having an MRI at 3 a.m. And I said, do not take it off. Do not take it off. And we did everything right with the pump. She did not take it off. It was wonderful. It was absolutely wonderful. Now, keep in mind too, though, if you get into a situation where you must take it off, both of these companies, Dexcom and Abbott, will replace.
Exactly.
Just call them up or go on their website, whatever you normally do to get a new sensor, and they will replace it. And I have patients who say, oh, that's a lot of work. It's not a lot of work because you don't want to be short one sensor. And things are changing now too, where there will be a coupon that will be sent. I know Dexcom's going to be doing this. I think Libre already does, where you get a coupon for these and you go right to your pharmacy.
Exactly.
You don't have to wait for the replacement.
Oh, good. Jen, talk to us about water and then go into airport security.
So for water, you can swim. We get this all the time, certainly. It's summertime. I'm in New England, so a lot of oceans here. So they're water resistant. The Libre 3 Plus is water resistant up to 3 feet, up to 30 minutes. And the G7, waterproof up to 8 feet. So you can jump off the high end of the pool for that one. Airport security. What I tell patients about airport security is don't be shy. When you're walking forward, give it point sensor so that you don't go through this thing, So you can wear it through the walk-through metal detector, but don't use it for that full body scanner. So wait till you're through the security area. You can, again, also the freestyle, same thing. So don't be shy. Point it out. Hey, I have a sensor. I can't go through that big body scanner.
And the reason, actually, what I thought was really interesting, because I called both the companies and said, tell me why, when you do the full body scan, if you can do an MRI, you can do it here, you can do it there. What is the issue? The issue is that the security is so secure that the companies can't get the information they need for the full body, for the full body scan. So they honestly don't know how it will affect. So when I go through airport security, I have metal in my hips, and so I have to do that full body scan. And I would have an issue only because they have no clue what it means if you do go through it.
We don't know that there's any problem, though. We don't want anybody listening to think you can't do it, that there's a problem. You can have options. You can explain to them. You can go through different things. You don't have to worry about it, because I've been through a lot of scanners with me and my diabetes. Now, one last thing I want to mention, a different area before we go talk to Jen about substances, is I hear questions regarding surgery. And, a lot of surgical places, my daughter actually wrote a surgical criteria for her outpatient surgery leaving CGM on. We just tell people, take it away from the site, make sure it's not going to be under a blood pressure cuff, make sure you plan ahead and that the individual, such as the anesthesiologist, is aware of it. And many times they're really game for leaving those on in those scenarios. Okay, Jen, take us to the next slide, talking about interfering substances, because there is a little bit of ambiguity and things are changing in this area.
Sure. So acetaminophen can falsely elevate some CGM readings. Vitamin C, hydroxyurea, also a known interference. But many people, vitamin C supplements, many people are taking. Most people don't purposely take more than 1,000 milligrams. So you can see, that you can take 1,000 milligrams or less with Libre 3 Plus, but don't forget, people take multivitamins with minerals, and then they have added supplements. So we need to make sure that if we're asking about vitamin C, we tell people to look at the label of their multivitamin to see if there's any vitamin C in there. Just remind people of that. I mean, I think that would be more common than hydroxyurea, for example.
Exactly. And
the other thing is always, if something doesn't seem right, doesn't match how you feel, that's when you might do a finger stick.
Yeah, and there are many things that can change CGM readings. We even had a comment just a minute ago about somebody getting a vaccine and they noticed that their numbers went up. Remember, it may not be the vaccine, it's that your body is developing immunity and fighting something off. So you got to look at the scenarios, because there are compounds, there are scenarios, there are different things that affect it for sure. Okay, so Davida, just touch a little bit on over-the-counter. We are not going to go in depth with this. We may have some future episodes looking at different ways to use over-the-counter, but just give us a slight little bit of information regarding over-the-counter sensors and how we should probably consider them.
Okay, so over-the-counter sensors, both the Dexcom Stelo, which is used for type 2 diabetes, not taking insulin, and the reason, and it doesn't have alarms, which is the big reason we don't use it for insulin. And then the Freestyle Libre Lingo, which is for health and wellness. And I would say that there's another 2 or 3 now on the market for health and wellness for individuals who do not have diabetes. I think it's a huge push, and it goes back to what I was saying, that CGM is a right, not a privilege, and that anyone who wants to and can improve their outcome should have it. So the Stelo is a 15.5 day with only 30-minute warm up, and its glucose range is 70 to 250, again because it's not for insulin, and its placement the same as the Dexcom 7. So the thing that's nice about it is, as it's moving forward, it's going to have some AI, or already has some AI, to take pictures of food to help the individual. And then Lingo with the others that are on the market for those individuals without diabetes. Again, we'll talk in another episode about how it changes lifestyle, maybe weight loss, nutrition. So those are great options for individuals, but you want to check the price. No prescriptions. Do not write prescriptions for these. Patients can buy them over the counter, and they need to shop around. And sometimes the cash price for some of the other sensors are better prices than the OTC. But
That's great. And Davida, can those be downloaded into EHR records or no? I don't think so. Yeah.
There's thank you. There's no data for us. The patient has to use it on their phone. There's no readers. And so there really is a lot of changes, but it's on the phone, it's phone based and nothing that we can upload. So that's another reason why in practice, we tend not to use the over counter if your world is diabetes like mine.
Well, one of my passions is really getting providers to download the data. And if you go back into some of our Sugar Queen episodes, we do a lot about AGP and downloading. So we don't want to forget that, because we can get all that information for the patient. But as a clinician, we really need to be beneficial and engage with that. And all persons on the diabetes team can benefit with that. So Jen, walk us through a little bit of integration of CGM with electronic medical records, and how are we downloading these things?
So I use what you see on the side, the Libre View and Clarity, that's how I'm accessing it. I'm using Epic, and although it has been approved now for integration, we don't have that capability yet. So, so data is only useful if clinicians can see it. Integration certainly is critical, but we have IT challenges. So that's the other thing to think about. So is there subscription fees, compatibility issues? So until then, what I'm doing is continuing to use those portals and copy and paste. I know Davida, I think, looked a lot into this issue. So she might have a little bit more to add for our viewers.
So I think Jen makes a great point, is that most of us are doing what she said. We cut and paste the charts that are important to us into the record enough so that we have a vision from visit to visit, and we have enough for billing purposes. And from my perspective, the integration might be a little young for most of us, but it's coming along. So with the Freestyle Libre, the key here is you must have in Epic, it's only Epic, the Aura software. And I tried to get it at Henry Ford, who has one of the most expensive Epics, and they said, no, not right now. We're not going to buy it. I'm like, but. So I thought, I tried. So I'm going to try again. But you must have Aura for it to be uploaded. And the beauty of the Freestyle Libre is that it's a direct data transfer. So it goes directly from their reader or phone directly into the charts. And from my perspective, it's the charts that I want and would normally use as being in an endocrinology practice. Now, Dexcom Clarity is also a direct upload, and you don't have to have this extra Aura thing. And the hub is Epic, so there's not an extra cost. It can only be from the G7 app of the Weara, and you have to have a newer 2023. But I find that the data that's uploaded from the Dexcom Clarity is more of a primary care view, which is not a bad thing. Because as Eden has already said, is we're really trying to get our colleagues to do it. And if I wrote a prescription, which is what you're doing here with these, and it automatically connects them to Epic, how beautiful would be that for the primary care then when they open the chart and they go, oh, look what I got, a bonus today. So it really is very automated. We're going to see changes with it in the near future. And people are really excited about those of them that get to use it. And it just reminds me, I better go call and maybe try and get Ori software in my thing again. But,
and we don't want to imply too that you have to have really expensive things. You literally, like Jen said, you just cut and paste the PDF. I put it in there and I acknowledge it. So can you talk a little bit about that really cool slide that you did in our prior Sugar Queen's Vault? I think we all love it because it was about CGM and device integration. And just as soon as we get this out of our lips, there's going to be some new integration, right? So catch us up right now with the current integration.
Yeah, you know what? The world of technology changes as we sleep. I swear to goodness. And it really does boggle my mind when I think I know, I don't know. But I love this slide, and I actually have it above my desk, and I'm looking at it right now and realizing that the one above my desk is already out of date. So, so let's start with It uses a G6 and a G7 and a Libre 3.0 Plus, and it's one of the easiest ones to go from sensor to sensor to sensor, because you just sort of toggle within the pump. And whichever of the iLet pumps you get in hand, you can use any of the sensors. So I love that about it. The InPen smart insulin pen is Simplera. Now, Simplera is not available for all of us. It's limited release, but it's very cool and it will be simple to use. And it looks very much like either a Libre 3 Plus or a G7. So it's small and easy to use. And then the 780G insulin pump has a Guardian 4. It will also be able to use the Simplera and the newest, which is it Insight? Another new
yeah.
Yes, Insight, which is another new sensor. So we didn't even get to add it to the slide as it got rolled out recently. And then Omnipod 5 has G6, G7, Libre 2 Plus, which is the confusing part because I said 2 Plus, not 3 Plus. And you have to have the right pods to match the sensor. So you have a G6, G7 pod, or you have a G6 Libre 2 Plus pod. So when you order the sensor, make sure the patient has the correct pod. And then Tandem X2 insulin pump is G6, G7, Libre 2 Plus. Then Mobi AID is G6, G7. And then the Twist AID is Libre 3 Plus. So note, iLet is 3 Plus, Twist is 3 Plus. But the other people that are using Libre is 2 Plus. And if that's not confusing, that is why we have this chart. Take a picture and keep it. And stay with us so we can continue and change. Because who's standing in front of me? What do you need? And then I really have to go in and double check my prescriptions to make sure, because if the patient gets the wrong sensor for the wrong pump, they cannot be integrated. The other thing that's new that I'll just mention is that the Dexcom G7 can go direct to an Apple Watch. You don't have to have it on your phone. The Apple phone doesn't have to be part of the process. You can go directly. And why is that important? Well, I recently saw a 6-year-old whose mother really didn't want to give him an iPhone, but gave him an iWatch. And so he could go direct. And I do know that the Libre will be doing that soon. So it's all Apple to Apple to Apple, but that is really nice if the patient's sensor can go directly to an Apple Watch.
Yes, I just put that on a school form yesterday about Apple Watch. Okay, moving on. Jen, talk to us about all in the stick. Give us some insight into how sensor adherence and all of those tricks.
In my opinion, the most important step is the alcohol wiping. So I tell patients, you need to rub it vigorously, rub that skin. So I'll tell it vigorously till it hurts. So they take 2 alcohol swabs. I tell them rub, flip it over, do the other one, because it doesn't matter if you took a shower today. There's going to be soaps, creams, whatever is there. So that will ensure that it's going to stick. It's a critical step. Most people, I have very, very rarely does somebody need an over bandage when they follow that step. But if they do, you can use an over bandage. You could use some skin tack. You could use skin prep, but don't occlude the sensor. So there's a hole in the middle to, keep the moisture away. So remind people also, be careful removing your clothes, gentle. If you remember the sensor's there, be gentle when you're taking off your clothes, wherever you have that sensor placed. Be careful with your seat belts. And
door jams.
Yes, some of us are going to walk in the doorways, so be careful when you're going through those doors. And then the other thing, if you're playing sports and you're running around, you could use like a fabric armband around that to keep it from falling off. And when you get out of the shower, gentle patting yourself. Don't be so. I use a hair dryer, because it heats it up a little bit and evaporates the water and kind of re-adheres it. That's my little queen pearl. So Davida, talk to us about preventing and addressing rashes or just even, mention just common skin
occurrences. I know when I take off mine, I still see it a little bit, but I don't have a rash per se.
So the number one thing to keep in mind is if a patient gets an irritation or a rash with one brand, that doesn't mean it's going to happen with the other brand. And if a person has a 2+ and they go to a 3+, that can happen, or a 6 to a 7. So it doesn't mean they can't use all sensors. So really keep that in mind. And it's usually the glue on the sensor that's causing the rash. So give them a surface underneath the sensor. And we use a lot of nose spray, the fluctosamine.
Flonase.
Flonase. We use a lot of Flonase. That sounds weird. Skin barriers, any of the skin barriers that you normally would use, any of the adhesive wipes to give them a surface. We use stick deodorant as a barrier as well. And then topical steroids or emollient creams, but they have to dry. And then also help me. What is that stuff you use? Something like that. That'll work as well. These are all things that you can put down as a barrier that often work for people who get a rash. Or sometimes people can only wear a sensor for 6 days. Then I rewrite the prescription and make note of that, that they can only wear it for 6 days because they get a rash after 6 days.
I've used dry salt even when people get sweaty and they have issues with that. I put it on a head. There's so many tricks out there. Calamine. Exactly.
That's it. Calamine lotion's a really good one as well.
Well, Jen, kind of get us looking towards the future at what we're at currently. Again, by the time we're done speaking, there's going to be something new out, but update us as of now.
CGM technology evolving rapidly. So coming soon. So Libre 2 and Libre 3 are being replaced with Plus. So unfortunately, any of you have patients out there that are on the 2 or the 3, it's being phased out. So you need to rewrite those prescriptions. So the pharmacy can't fill it, DME can't fill it. You need to write Plus. So start switching people right away.
Exactly.
The readers for the 2 and the 3 will work with the Plus, 2+ and the 3+. You don't have to if you're not using the app. Abbott has a new app. It's black with a yellow butterfly in it. So that's what you find.
It's called Libre by Abbott. Libre by Abbott.
And it's a little prettier for them. And that works for the 2, 2+, 3, and 3+. And what it does for the 2 and the 2+ is eliminates that need to scan. So you still have to scan to activate it, but then you don't have to scan. You can just look at your phone. So that's wonderful. And lastly, wonderful, Dexcom G7 15-day sensor approved by the FDA should be here by this year. And I'm sure more things are going to be happening by the next episode.
Can I just say one thing about the Dexcom G7 15-day? Make sure when patients are ready to move to it, that it's also approved if they're on AID pumps. So if they're on a G7, make sure that the 15, and I think Dexcom's plan is to release it when they can also, but they have to get that with the pumps. So if your patient's on a G7 and they want to go to a 15, you've got to make sure that that pump can accept the 15-day
compatibility. Make sure that compatibility. Also with the Libre by Abbott, that new app, which does both sensors, you can actually silence alarms in scenarios for time with that as well. Okay, Queens, we're coming towards the end. Did we miss anything? Do we have any parting words? I know you mentioned briefly, Davida, about sensor fall off, but or sensor failure, we still see this a lot in our clinicians. They're having patients call the pharmacy or their insurance. Don't do that. The manufacturers are here for any troubleshooting, after hours issues, fall off. So please, if you got any questions regarding that, the manufacturer, that's what they're here for. They got a lot of those resources.
For a very short period of time, Dexcom limited the number of sensors they give you if you had failures. That's gone. So they recognized that was not going to work, and they wanted to be much more friendly, patient friendly. So that is gone.
Well, Queens, we gave them a drink out of a fire hydrant today. I mean, we were just giving it to them left and right. You know, there's never enough time. Thank you so much, Davida and Jen, for providing us those pearls. Make sure you claim your CME or CE credit by scanning the QR code below. But also, we so love to have you and that you participated in this activity. We always love seeing you every month. Please bookmark our season 2 here on YouTube. All our recordings are archived of the Sugar Queens. So go back and check us out. We had some pretty fun stuff there. So we can't wait to see you next time. Till next time.